Welcome back, everyone, to OpenLine, talking about healthcare expansion in Tennessee. We have with us Andy Spears, Executive Director of Tennessee Citizen Action. Senator Mark Green, Republican Clarksville, could not join us. Lots of calls. Appreciate all the calls. Let's go to Bob. Hello, Bob.
Hello. Good program. I'm glad you have a good speaker there. I got a disability, and I had a choice of paying out of my check for insurance or not. And, you know, Obamacare has been since, 2007 or 8 or 9. It's law, and it's still law, and they're supposed to do what they're supposed to, but states have their own thing. And that's helped me a lot. I'm concerned, you know, I've got coverage in A, B, and D, and it's finally kicking in, finally.
Okay.
But this shunting the money, or the government, the governor gave it a shot to try to do it his way, and they turned on him too. So got to get rid of Obamacare. That's just ridiculous.
So you're covered under the Affordable Care Act right now, is that correct?
Yes.
And you're concerned
it's for those,
about
if they don't make it's like they're playing Monopoly when it should be the game of life. You got to make the right choices, and they don't understand, or something like that.
Mm-hmm.
You know, it might take a little money to get the system going and up and going, but just to refuse the taxpayers' money that they sent to Washington, but it's turned into a lawyer's game because it's better to have a government.
All right. Well, let's talk about what you said. Here's someone who's covered by the Affordable Care Act,
right,
but worried about this debate and its impact on him. What would you say there?
Well, I would say, one, if you already have coverage and it's coverage you like, this doesn't impact you at all. And I think the other thing I heard Bob say was he's worried about people who are kind of missing out on the expanded access to coverage. So like I said, you have people at the low end of the spectrum who either aren't working or make so little working that they qualify for TennCare. And you have people who have access to employer coverage, and they can afford to pay for part of that care. And then you have people in this coverage gap, the 250,000 Tennesseans, who, unlike Bob, can't access the health care. And so the other thing I heard him say was, Tennesseans are sending their tax dollars to Washington. Why not, and this is what my response to Greg was, why not get some of that money back to take care of our neighbors? And that's what, we want consumers to have a choice. Consumers have more choices when we get to keep the federal money. It's a plan that's designed by Tennesseans. Governor Haslam designed the plan in consultation with his health policy advisors. It's a plan to move the state forward to provide coverage like what Bob has to more Tennesseans.
And just to push back, it is the concern that Greg and others have is the bloated government. Is that what do you say to that argument? They say, yeah, sure, we could be getting money back that we send off to the federal government, but bottom line is we should be sending less to the federal government.
First of all, I would say that access to affordable health care is fundamental to being able to exist. You can't, unless you never get sick and never have an illness, you have to have access to affordable health care. And so what that means is if you don't have insurance and you're in this group and you're making $8 an hour, that's an hourly job. You can't miss work because you're sick for a week. Having access to health care helps prevent that. So what I would say is we absolutely, like Greg said, should be prioritizing our money. And certainly there are ways we can save money. But providing access to health care, Greg and I both just paid our taxes this weekend. I would like that money to stay in Tennessee to help my neighbors out. Bob wants his neighbors who are not as lucky as he is to get coverage. And I think we're a lot better off when Tennesseans control the tax dollars than when people in Washington control those dollars.
Now, this has been a major issue, obviously, this session, though it hadn't been really debated on the floor, but it's been in the background. Other health care issues that you have been following, other health care bills that are being proposed and talked about, what have you seen up there?
I think there have been a lot of discussions. One of the discussions from your guest who was supposed to be here was basically it was one half of Governor Haslam's plan. So it was the healthy incentives half, where people would get health savings accounts and then be rewarded for doing things like not smoking and improving their cholesterol and exercising and things like that. So they would get credit toward the plan and also have to pay some. But it would be one half of the plan. Now, that never got to be debated because we never had a floor debate on either the House or the Senate this year. It basically didn't go anywhere.
Word is that is popular. Word is that could pass.
Well, and I think so. I think because it's a relatively small amount of money, and it's very heavy on personal responsibility. That's something that I think you could get some votes for. To Senator Green's credit, he didn't vote last year. He wasn't a no vote. He didn't vote last year, and it was holding out hope that we would have a better option in the next session. Unfortunately for Senator Green and for others who want compromise, they didn't even get a chance to debate it. So I think that's where the failure comes down. Speaker Ramsey made no real secret that he wasn't really in favor of this, and Speaker Harwell had an opportunity to bring this to the floor and didn't. So we could have been debating Mark Green's alternative plan. Had we put this on the floor, we could have amended out the parts people didn't like. That didn't get to happen because we never had that discussion.
When you start talking about health savings accounts, does that mean there's a pot of money that's given to someone, and then they have, once they're out, but they have to go and ask their doctor, okay, how much will this procedure cost?
Right. It's heavy on consumer choice. The way I understand that part of the plan is it would use this federal money so people would get access to the money in exchange for taking on these healthy behaviors. So if you're a smoker, you'd have to go through smoking cessation and things like that. And then you would get access to the funds. And like you said, so let's say it's $5,000. When $5,000 is out, you can't go anymore. But right now, you can't go at all.
Right.
So you're right. It gives the consumers the ultimate choice and power over their healthcare dollars.
And what are you seeing in other states?
Well, so our neighboring state in Kentucky expanded Medicaid under the traditional path. That provided 400,000 people with access to care. They calculated about $1.5 billion came back to their state from the federal government. They have a new governor who has promised to repeal that program, but so far hasn't figured out a way to do that. So those Kentuckians are still covered.
That new governor came in and said he was going to repeal it.
Yeah, he did, but he hasn't been doing that. I think one of the reasons is that's a good way to make 400,000 voters and their families really mad, and he might want to be reelected. So it's easy to say that on the campaign trail, a lot harder to unwind that once you get into office and realize.
But you would think on the campaign trail that people would get upset then. But
Right.
people not understand. Do you think there's not a connection?
I think there's a disconnect. So I think the interesting thing in Kentucky is a vast majority of Kentuckians oppose Obamacare, and a vast majority of Kentuckians support Connect, which is their Medicaid expansion program. So there is definitely a disconnect between Obamacare and Medicaid expansion, which the only reason why you have Connect is because of Obamacare or the Affordable Care Act. And the same would be true of Insure Tennessee, and that's why politicians are scared, because they're afraid that an outside group's going to say, you're adopting this Obama healthcare policy. But the experience in Kentucky is people who got the coverage like it. Democrats controlled the House before the governor's election. There were several special elections just recently. Democrats controlled again, even though they promised to preserve Kentucky's version of Medicaid expansion. So the political lesson is they took a risk in a state where President Obama is just as unpopular as he is in Tennessee, and they got reelected. And so for Tennesseans who are worried about that, I would say, if you help your community save your hospital and you help your neighbors keep their health care, they're going to reward you with votes.
And the proverbial elephant in the room for all of this discussion is that we are about to have a presidential election.
Yes.
And this is at the forefront. Both sides have a very different opinion,
Yes.
and both sides, when they get elected, will say it's a mandate on this very issue. When you were speaking a minute ago, though, you were concerned that the political climate wouldn't change.
Well, because if a Republican were to win, all of them have said they're going to repeal the ACA, which means that this type of program wouldn't be available for Tennessee or for any other state. If the leading Democrat wins, I would imagine that she's just as unpopular as President Obama in Tennessee, and so you'll have the same thing, only commercials with, Representative so-and-so and Hillary Clinton. And that's probably not going to go as, not going to go over well just like the President Obama does. So that climate's not going to change, and we have a health plan that was crafted by Bill Haslam and his health policy experts, Republicans. That's a middle-of-the-road plan. It's a compromise plan. Why not put it on the floor? And if the only part of it that can pass is the part that Mark Green wants, let's have that. Let's amend out the parts people don't like, and let's start with that, and maybe we can build on that type of program. But we can't even have that discussion unless we. And by the way, they're coming back tomorrow. There's no reason why they can't have this debate tomorrow.
But I bet they won't. All right, we're going to take a break. We'll come back, wrap everything up. Be back right after this.